Hi, Monique. I guess like everyone else right now, you're probably working from home. Is that right?
Yep, I certainly am. As you can see from my backdrop, this is definitely not an office. It looks, if anything, more like a bit of a pet store, probably. But yep, this is my lounge room. So, of my small apartment, which I'm now sharing with my partner and my daughter, full time, 24/7. So,
And meantime, I know you're really busy. We should explain your work in ordinary times, you deal with the flu. Is that right?
that's correct. So, the flu and other infectious diseases in general. So, mainly respiratory viruses. Which COVID is, which is perfect.
Yeah, exactly. So, in fact, you were working on infectious diseases and all of a sudden COVID popped up on your radar. When did you first realize that COVID was going to be a big problem?
We're watching it very closely from about January in the year, and it just started escalating. So unlike, MERS, which happened in 2015 in South Korea, it looked like this was starting to spread to other countries quite quickly. So I was getting up at 3 a.m. and listening to the World Health Organization press conferences from, mid-January onwards, really. So, and yeah, it's only a couple of months. It's crazy to think it's only been a couple of months, and here we are now in the midst of a total worldwide pandemic.
It's
So,
hard to believe. It genuinely is. Starting with what you were doing, what was the kind of work? Where are you when you're not in your lounge room working from home? Where are you when you're working on this? Sorry, we're working from home too. And I realized that we're doing double Zoom calls. My husband's doing a call even as I speak.
oh, it's great. So normally I work for the University of Adelaide. I work as a program manager for the for an influenza and infectious diseases surveillance system. So we obtain data from GPs on the number of people who present with symptoms that are commonly associated with flu. So the data we collect are utilised by federal and state health departments and the World Health Organization to determine what strains of flu are circulating in Australia. This information is used to determine what strains of flu to put in the vaccine and to calculate how effective the vaccine's been. So,
And is that, well, that obviously sounds like it's applicable to COVID, is it?
yep, so absolutely. So, in response to the pandemic, we're now testing for COVID-19. So, our role in the pandemic is particularly important as our surveillance aims to detect the community transmission of COVID. So community transmission is cases that aren't linked to overseas travel or contact with a known case. So our health departments are doing a fantastic job of isolating known contacts of cases. Community transmission is essentially people who have slipped through the cracks. So they could have obtained the virus from the environment, for example, from touching a door out in public, or that another infected person had touched, or perhaps from contact with an asymptomatic case. So once we start seeing sustained community transmission, the government will implement stricter public health measures. And we've seen this in some parts of Australia already. As well as managing these surveillance activities, I'm also completing a PhD in medicine, looking at ways to improve infectious diseases surveillance in Australia.
So I think what's really impressive is that you mentioned that almost as an aside, Monique. And in the meantime, I'm completing a PhD. How has working on that PhD been affected by what's going on and the nature of your work, which is so vital to this heating up?
So yeah, my PhD is not, it's sort of been put on hold at the moment to deal with the COVID work. So we had such a big flu season last year. I was actually hoping for a break this year as we never normally see two big flu seasons in a row, but the Rona had other ideas. So we've had to work at modifying our surveillance activities to include COVID-19. So I've been working like 60-hour weeks, working on modifying our databases, data reporting methods, forms and instructions for GPs, as well as providing messaging to our doctors in this constantly evolving situation. So this requires me to be up to date with all the latest research, data and public health interventions. So I basically wake up reading COVID news from around the world and then go to sleep reading publications on PubMed.
And in the meantime, you were a Fulbright scholar. Tell me about what your Fulbright scholarship entailed.
So my full project was, and I say that in past tense, looking at the augmentation of the Flu at Home app. So the Flu at Home Australia project was a project that we started in the first phase of last year in conjunction with the University of Washington and a non-for-profit called OutArray. The aim of the project was to test the usability of an in-home test for the flu. The test consisted of a lateral flow test, very similar to a pregnancy test. The test had been around for years, but had very poor accuracy. The idea is that we could improve the accuracy of the test by development of an app, which is the Flu at Home app. The app had two purposes. Firstly, it was included a reader, which took a photograph of the strip. The line on the strip was often very faint for positive results, too faint for the human eye to see. But the reader was programmed to be able to detect the line, even when the naked eye couldn't see it. The second purpose of the app was to collect information about the patient's symptom and risk factors for influenza.
So
the second phase of the project was
I'm sorry to interrupt you. Is that applicable to COVID in any way, shape, or form, Monique?
So we're looking at modifying the app to actually ask questions about COVID, and depending on what point of care tests we use, we might modify other parts of it as well. So definitely, it's all very similar. Flu and COVID have got lots and lots of similarities, which means that sort of transferability of from one to another will be quite easy. Except for we don't like the name coronavirus at home. We think that that doesn't have quite the ring as flu at home does. So.
And I can understand that. I also understand, and I should ask you this as an expert, I know that there has been a lot of messaging around the fact that although there are similarities, there are also a lot of differences between what we think of as the typical flu and COVID-19. Is that accurate?
That's correct, yes. Yes, even between different strains of flu, there's lots of differences. So it's crazy how just a few differences in DNA bases can really change viruses and the way they interact. So.
And COVID is much more dangerous, is that correct?
It is. It spreads very quickly, and its case fatality ratio is a lot higher. So, but then if we compare it to other pandemic flus, say the 1918 pandemic, there was lots of similarities there in terms of, they think now with modelling that if we'd have let COVID, if we hadn't have been able to control COVID like we have, it would have been about the same number of deaths that would have been in 1918, which they estimate to be 40 to 80 million people around the globe. So huge numbers. So
really, so science has really helped us to get a handle on that. And when we talk about that, Monique, I want to come back to your Fulbright for a moment, because I know with your Fulbright scholarship, you did connect to a university in the United States. And while the project is changing, those relationships, I would imagine, are still really important. Can you explain that?
Yeah, absolutely. I mean, Fulbright's been amazing. It's had a huge impact on my work, even though I haven't actually officially commenced yet. I've been given these opportunities, as you mentioned, to collaborate with other groups from the US for this COVID-19 point of care testing project, and have received offers to work on other infectious diseases projects as well, none of which would have been possible without Fulbright. So it's incredible what doors are opened up in the US when you mentioned the magical F word.
In particular, I understand there's a university on the West Coast that you've been working closely with.
That's correct. So the University of Washington in Seattle. So they're the ones that originally funded the Flu at Home project. We collaborated with them for the Flu at Home project. Sorry, we're funded by an external source. And so another lab in the University of Washington is actually creating this COVID point of care test.
So how closely are you in touch with them? In other words, is this ongoing as we speak? You're still in touch with the University of Washington in Seattle, even though the Fulbright project had to be tabled?
Absolutely. I've actually got a meeting with them straight after this. So we're catching up weekly at the moment just to try to determine what sort of studies we could do using this point of care test, and what sort of funding we could look at. So yeah, we're hoping to roll it out in our clinics over this winter, fingers crossed. So full steam ahead. So
yeah, well, and you know what, could you explain that for me? Because I think some people might be confused. I mean, we know that the program had to be curtailed. People had to go back to their various countries, and that got put on hold. But in a way, Fulbright's more than that, isn't it? I mean, the relationships continue. Is that correct?
Absolutely. Yeah, the travel component is just one small part of it, really. So like I mentioned before, we've been given opportunities to collaborate with groups that I probably wouldn't have gotten if it wasn't for Fulbright. So and those collaborations can occur, you know, over Zoom or email or any other way that doesn't include travel as well. So it's great to be able to sort of pledge ahead with these projects. So
given your expertise, I should ask you, what are your predictions for this pandemic?
If I was able to predict how the pandemic would play out, it'd be hot property right now. In all seriousness,
Your property anyway, Monique, as far as we're concerned.
oh, thank you. In all seriousness, though, in Australia, we are in a fantastic position. Unlike other countries, we were able to implement social distancing measures early, and as a result, we still don't have sustained community transmission. So we were able to test a large proportion of the population, and our contact tracing has been some of the best in the world. During this time, we've been also increasing our hospital capacity to deal with increasing cases. In saying this, unlike other countries in the Northern Hemisphere who are currently in spring going into summer, we still have the whole of winter ahead of us. So my biggest concern at this point of the pandemic is that we become too complacent. Already there's pressure from businesses to relax restrictions. So my hope for how this will play out, rather than a prediction, is that we keep strict social distancing measures in place until we're certain that there's absolutely no community transmission of the virus. And then we put all of our efforts into quarantining any possible sources of infection from overseas upon arrival. So this would most likely include like hotel quarantine or some sort of tracking via some sort of device. Because we've seen in the past where confirmed cases have just had a blatant disregard for the isolation guidelines. And we've also seen how infectious this virus is. It only has to take one person doing the wrong thing to cause the virus to spread out of control. So it would be great if we could all work together as Australians to combat this virus. So
We'll let you wrap it up there. Is there anything else that you want to pass on to everyone?
This is just a phase in time, right? So it will be over and we'll be different at the end of it. The world will change. Just try and enjoy the small, simple pleasures right now. So the silver lining stuff. So, I'm getting to spend my whole day with my family. We're doing things like going for walks regularly, really have that total different simplistic life, I guess you could call it. And it's nice. So I know it's hard for a lot of people not being able to go out and enjoy the things that they normally do, but just think about the spread and think about the people that you're saving, and and just try and enjoy it for what it is. So
Monique, thank you so much. Great advice and great perspective, and congratulations on everything that you've achieved so far, and we look forward to seeing what's coming down the track.
Thanks so much, Sarah. Appreciate it. Have a good day.
You too. Stay safe.